Have you ever wondered if your daily habits might be silently increasing your cancer risk without you even knowing it? That gnawing fear that something you're doing every single day could be setting the stage for a devastating diagnosis months or years down the road. I see this worry in the eyes of every patient who walks through my clinic doors. Just last month, Robert, a vibrant 72-year-old who always prided himself on his health, sat across from me completely shattered after discovering his stage 3 colon cancer. The most heartbreaking part? He kept repeating the same question through his tears. If I had only known sooner, why didn't anyone warn me about this? What Robert didn't realize is that for years he had been unknowingly engaging in several common habits that dramatically increased his cancer risk. These aren't exotic behaviors or rare exposures. They're everyday things millions of seniors do without a second thought. Today, I'm going to reveal the 5 most dangerous, yet overlooked habits that significantly raise your cancer risk after 60. This information isn't commonly shared, even by most oncologists, but it could literally save your life or the life of someone you love. So please, stay with me until the end, because what you don't know about these hidden risks could be the difference between health and a devastating diagnosis. Hey there, thanks for joining me today on this incredibly important topic. Before we dive deeper, I'd love to know where you're watching from. Drop your location in the comments below so I can get to know this amazing community better. And if you have any questions about cancer prevention for seniors, don't hesitate to ask. I read every comment and try to address as many questions as possible in future videos. If you're new here and want to stay informed about the latest cancer research and prevention strategies specifically for older adults, hit that subscribe button and turn on notifications. This channel is dedicated to empowering seniors with life-saving information that most doctors simply don't have time to explain during your standard 15-minute appointment. The moment I tell patients about these 5 dangerous habits, I always see the same look of disbelief. Many have been doing these things for decades without ever realizing the harm they could be causing. What makes this information so critical is that after 60, your body's natural cancer-fighting abilities begin to decline, making these seemingly innocent habits much more dangerous than they were in your younger years. The cancer protection systems that once efficiently eliminated damaged cells now work more slowly, allowing potential cancer cells to gain a foothold. This is why cancer risk increases dramatically with age, and why these 5 habits become particularly dangerous after your 60th birthday. I want to take a moment here to ask you something important. What health concern keeps you up at night when it comes to cancer risk? Is there a specific symptom you've been worried about, or a family history that weighs on your mind? You know, so many of my patients tell me they feel completely alone in their fears, as if no one else could possibly understand the weight of this uncertainty. I want you to know that those feelings are not only normal, they're incredibly common among people your age. This community understands what you're going through because many are walking the same path. If you'd like to share, you can simply copy "My biggest cancer concern is," and tell us what's on your mind. Even just a few words can make a difference. Your comment might be exactly what someone else needs to read today to feel less alone in their journey. Plus, understanding your specific concerns helps me create more targeted, helpful content that addresses the real issues keeping you awake at night. Let's start with the first dangerous habit that significantly increases cancer risk after 60, ignoring persistent acid reflux, or heartburn. Many seniors dismiss heartburn as just another uncomfortable part of aging, treating it with over-the-counter medications without addressing the underlying cause. What most don't realize is that chronic acid reflux, technically called gastroesophageal reflux disease or GERD, can lead to a condition called Barrett's esophagus, where the lining of the esophagus changes due to repeated acid exposure. This condition increases your risk of developing esophageal cancer by approximately 30 to 40 times compared to the general population. Esophageal cancer is particularly dangerous because it's often detected at late stages when treatment options are limited and survival rates are low. In fact, the 5-year survival rate for advanced esophageal cancer is only about 20%, making early detection and prevention absolutely critical. What makes this especially troubling for seniors is that GERD symptoms often become more common after 60 due to weakening of the lower esophageal sphincter, the muscle that prevents stomach acid from flowing back into the esophagus. Additionally, many medications commonly prescribed to seniors, including certain blood pressure medications, calcium channel blockers, and some antidepressants, can worsen GERD symptoms by relaxing this same muscle. Have you noticed how your heartburn might have worsened after starting a new medication? This could be why. The mechanism behind this increased cancer risk involves DNA damage from repeated acid exposure. Stomach acid is highly corrosive by design. It needs to be to break down food. When this acid repeatedly bathes the delicate tissues of your esophagus, it damages the cellular DNA, potentially leading to mutations that can trigger cancer development. In my practice, I've seen too many patients who ignored their reflux symptoms for years, only to be diagnosed with esophageal cancer at an advanced stage. Jim, a 67-year-old retired teacher, had been managing his heartburn with over-the-counter medications for over a decade. He considered it just an inconvenience, not a warning sign. By the time his difficulty swallowing prompted proper medical attention, his esophageal cancer had already spread to nearby lymph nodes. Instead of dismissing heartburn, seniors should take these symptoms seriously and consult with their doctor if they experience frequent reflux, especially if it's accompanied by difficulty swallowing, unexplained weight loss, or chest pain. A gastroenterologist can perform an endoscopy to examine the esophagus and check for signs of Barrett's esophagus or other precancerous changes. If caught early, these changes can be monitored or treated before they progress to cancer. Simple lifestyle changes can also help reduce reflux symptoms and potentially lower cancer risk. Eating smaller meals, avoiding eating within 3 hours of bedtime, elevating the head of your bed, and avoiding trigger foods like spicy dishes, citrus, tomatoes, chocolate, and caffeine. Maintaining a healthy weight is also crucial, as excess abdominal fat puts pressure on the stomach, increasing the likelihood of acid reflux. But perhaps most importantly, don't simply mask symptoms with medications without getting to the root cause. While antacids and acid reducers have their place in treatment, they should be part of a comprehensive approach that includes proper medical evaluation and lifestyle changes. Have you been ignoring your heartburn, thinking it's just a normal part of getting older? This could be one of the most dangerous assumptions you're making. The second dangerous habit that significantly increases cancer risk after 60 is sedentary behavior, spending the majority of your day sitting or lying down. As we age, it becomes easier and more comfortable to adopt a sedentary lifestyle. Retirement often means less daily activity, joints might be more painful, and energy levels may naturally decline. However, this reduced activity comes with serious cancer risks that many seniors aren't aware of. Multiple large-scale studies have linked sedentary behavior to increased risk of several cancers, including colon, endometrial, and lung cancer. One particularly comprehensive study published in the Journal of the National Cancer Institute found that for every 2 hours spent sitting, colon cancer risk increased by 8%, and for those sitting more than 6 hours daily, the risk was 30% higher compared to people who sat less than 3 hours per day. This association remains significant even after accounting for other risk factors like diet and body weight. But why does sitting increase cancer risk, especially after 60? The biological mechanisms are complex, but increasingly well understood. First, prolonged sitting negatively affects metabolism, leading to higher insulin levels and insulin resistance. Elevated insulin acts as a growth factor for cancer cells, essentially providing fuel for potential tumors to develop and grow. Second, sedentary behavior reduces muscle contraction, which normally helps to clear glucose and fats from the bloodstream. This leads to increased inflammatory markers in the blood, creating a pro-inflammatory environment throughout the body that promotes cancer development. Third, and particularly relevant for older adults, prolonged sitting accelerates the age-related decline in immune function. Your immune system plays a crucial role in identifying and destroying abnormal cells before they can develop into cancer, but this surveillance system becomes less efficient with both age and inactivity. I remember Patricia, a 75-year-old patient who came to me after a stage 2 colon cancer diagnosis. She had been incredibly active throughout her life until knee problems in her late 60s drastically reduced her mobility. Over the next several years, she gradually became more sedentary, eventually spending about 12 hours a day sitting while watching TV or reading. She had no family history of colon cancer and maintained a relatively healthy diet, but her sedentary lifestyle likely contributed significantly to her diagnosis. The good news is that this risk factor is modifiable, even for seniors with mobility issues or chronic conditions. Research shows that breaking up sitting time with even short periods of light activity can help mitigate the negative metabolic effects of prolonged sitting. Even something as simple as standing up and walking around for 2 to 3 minutes every hour can make a difference. For those physically able, aim for at least 150 minutes of moderate activity per week, as recommended by the American Cancer Society. This doesn't need to involve strenuous exercise. Brisk walking, swimming, or water aerobics are excellent options for seniors. Even chair exercises or gentle yoga can help if mobility is limited. The key is to find activities that you enjoy and can sustain over time. One practical approach is to build movement into your daily routine. Consider setting a timer to remind yourself to stand up and move every hour. Try standing while talking on the phone or marching in place during TV commercials. Park farther from store entrances to add more steps to your day. Every bit of movement helps to counteract the negative effects of sitting. The cancer prevention benefits of staying active extend beyond just reducing sitting time. Regular physical activity helps maintain a healthy weight, improves insulin sensitivity, reduces inflammation, enhances immune function, and improves digestion and transit time in the colon, which reduces exposure to potential carcinogens in food waste. Have you been spending most of your day sitting without realizing the cancer risk it poses? This habit could be silently increasing your cancer risk more than you know. The third dangerous habit that significantly increases cancer risk after 60 is neglecting proper hydration and relying on sugary or artificially sweetened beverages instead of water. This might seem surprising. After all, how could your beverage choices possibly impact your cancer risk? But numerous studies have established concerning links between certain drink preferences and various cancers, particularly in older adults whose bodies are already more vulnerable to cellular damage. As we age, our sense of thirst naturally diminishes, making dehydration much more common among seniors. At the same time, many older adults replace water with coffee, tea, sodas, juices, or artificially sweetened drinks, not realizing the potential consequences of this seemingly innocent habit. Let's look at the scientific evidence. Studies have shown that insufficient water intake is associated with increased risk of bladder cancer and colorectal cancer. When you don't drink enough water, toxins become more concentrated in your urinary system and waste moves more slowly through your digestive tract, increasing exposure time to potential carcinogens. Research published in the International Journal of Cancer found that people who drank less than 5 glasses of water daily had a 50% higher risk of bladder cancer compared to those who drank more. This risk was particularly pronounced in older adults. But the problem isn't just about not drinking enough water, it's also about what many seniors drink instead. Sugar-sweetened beverages have been linked to increased cancer risk through multiple mechanisms. High sugar intake leads to insulin resistance and chronic inflammation, both known contributors to cancer development. A large-scale study published in the British Medical Journal, following over 100,000 adults, found that just a 100 milliliter increase in sugary drink consumption per day was associated with an 18% increased risk of overall cancer and a 22% increased risk of breast cancer. Artificially sweetened beverages aren't necessarily a safer alternative. Some studies have found associations between artificial sweeteners and cancers of the urinary tract and digestive system. While more research is needed, there's enough evidence to suggest caution, especially for seniors who consume these beverages daily over many years. The risk may be compounded by age-related changes in how our bodies process and eliminate artificial compounds. I witnessed this connection firsthand with my patient George, a 78-year-old with a recent diagnosis of aggressive bladder cancer. During our discussions about his lifestyle, I discovered he rarely drank plain water. Instead, he consumed 6 to 8 cans of diet soda daily, a habit he'd maintained for over 2 decades. While we can't definitively say this caused his cancer, the scientific literature suggests it may have been a contributing factor. The physiological mechanisms behind these connections are becoming clearer through research. Chronic dehydration stresses cellular function and repair mechanisms. Your cells need adequate water to maintain proper DNA repair processes that prevent mutations from accumulating. Water is also essential for effective kidney function, helping to filter toxins from your bloodstream. Additionally, proper hydration supports optimal immune function, which is crucial for identifying and eliminating potentially cancerous cells before they can develop into tumors. For older adults, achieving proper hydration might require some conscious effort. As a general guideline, aim for about 6 to 8 cups, 48 to 64 ounces, of water daily, adjusting for activity level, climate, and medical conditions. Keep in mind that certain medications common among seniors, such as diuretics for high blood pressure, can increase fluid needs. Practical strategies include keeping water easily accessible throughout your home, setting regular reminders to drink, and perhaps using a marked water bottle to track intake. If you find plain water unpalatable, try adding slices of fruit for natural flavor, or opt for herbal teas without added sugar as an alternative. For those concerned about nighttime bathroom trips, try front-loading your water intake earlier in the day. Have you been neglecting water in favor of other beverages, not realizing how this might be affecting your cancer risk? This seemingly minor habit could be having major health consequences. The fourth dangerous habit that significantly increases cancer risk after 60 is avoiding routine cancer screenings due to fear, inconvenience, or the false belief that advanced age makes them unnecessary. Many seniors mistakenly think that once they've reached their 70s or 80s, cancer screenings become less important. Others avoid these potentially life-saving tests due to anxiety about possible findings or discomfort with the procedures themselves. This avoidance behavior is particularly common among older men who tend to be more reluctant to seek preventive health care. However, the statistics tell a powerful story about why cancer screenings remain crucial throughout our senior years. According to the American Cancer Society, more than 60% of all cancers are diagnosed in people aged 65 and older. At the same time, many cancers that are highly treatable when caught early become significantly more deadly when detected at advanced stages. For example, the 5-year survival rate for localized colorectal cancer is over 90%, but this drops to just 14% once the cancer has spread to distant parts of the body. Similar patterns exist for breast, prostate, lung, and other common cancers. The science behind cancer screening is clear. Regular screenings can detect precancerous conditions or early-stage cancers before they cause symptoms, when treatment is most effective and least invasive. For instance, colonoscopy can identify and remove precancerous polyps before they develop into colorectal cancer. Mammograms can detect breast tumors when they're still small and contained. PSA tests and digital rectal exams can identify prostate abnormalities that warrant further investigation. I'll never forget Eleanor, an 82-year-old woman who cancelled 3 consecutive mammogram appointments because she felt that, at my age, what's the point? When she finally came in for screening after experiencing breast pain, we discovered a stage 3 cancer that had already spread to nearby lymph nodes. With tears in her eyes, she told me, "I always thought that if I got cancer at this age, I'd rather not know. I never realized there would still be good treatment options that could give me more quality years with my grandchildren." Her case illustrates a common misconception that advanced age means limited treatment options. In reality, cancer treatments have evolved significantly, with many options now available that are well tolerated even by older patients with other health conditions. Some screening recommendations do change with age, but they don't simply stop at an arbitrary birthday. Instead, screening decisions should be individualized based on overall health status, life expectancy, personal preferences, and risk factors. A healthy 75-year-old might benefit from continued screening, while someone of the same age with multiple serious health conditions might reasonably choose to discontinue certain tests. The key is making these decisions through informed discussions with healthcare providers, not avoiding the conversation altogether. For seniors specifically, these are the screenings that remain important, though frequency may vary based on individual circumstances. Colorectal cancer screening through age 75, and on an individual basis from 76-85, breast cancer screening continuing based on a woman's health status and expected longevity. Prostate cancer screening discussions should continue for men with at least a 10-year life expectancy. lung cancer screening for current smokers or those who quit within the past 15 years through age 80, skin checks for unusual moles or growths, which should continue indefinitely. I encourage all my senior patients to create a screening schedule with their primary care physician, taking into account their personal and family history. If anxiety about the procedures is a barrier, discuss this openly with your doctor. Many screening methods have become less invasive and more comfortable in recent years, and various techniques can help manage anxiety during the process. Have you been postponing or avoiding cancer screenings, thinking they're no longer necessary at your age? This misconception could literally be the difference between life and death. The fifth dangerous habit that significantly increases cancer risk after 60 is ignoring unusual or persistent symptoms due to the assumption that they're simply normal parts of aging. Many seniors dismiss subtle body changes that could be early warning signs of cancer, attributing them instead to just getting older. This normalization of potential cancer symptoms is one of the most common reasons for delayed diagnosis in older adults, often allowing the disease to progress to more advanced stages before detection. Our bodies are remarkably good at sending signals when something isn't right, but these signals can be easy to misinterpret, especially as we age and experience various changes. Fatigue, for instance, is often dismissed by seniors as age-related energy loss, but persistent fatigue that doesn't improve with rest can be a symptom of several cancers, including leukemia, colon cancer, or stomach cancer. Similarly, unintentional weight loss might seem like a positive change, especially for those who have struggled with weight, but losing weight without trying could indicate pancreatic, esophageal, or lung cancer. The research on symptom recognition and cancer outcomes is clear. A large British study published in the British Journal of Cancer found that patients who recognized cancer symptoms and sought prompt medical attention had significantly better survival rates than those who delayed seeking care. This effect was particularly pronounced in older adults, where each additional month of delay before diagnosis was associated with measurable decreases in survival rates for many common cancers. I remember David, a 71-year-old patient who had been experiencing increasing difficulty swallowing for nearly 8 months before seeking medical attention. He had assumed it was just another aggravation of aging, perhaps related to the mild acid reflux he'd had for years. By the time he mentioned it during a routine checkup, his esophageal cancer had already reached stage 3. I just thought it was normal, he told me, that as you get older, things just don't work as well as they used to. This mindset, normalizing potential warning signs, is particularly dangerous because many cancers that affect seniors are highly treatable when caught early. For example, colorectal cancer has a 5-year survival rate of over 90% when detected at a localized stage, but this drops dramatically to around 14% once the cancer has spread to distant parts of the body. What makes symptom recognition especially challenging for older adults is that many cancer symptoms can indeed mimic normal aging or common conditions in seniors. Bone pain might be dismissed as arthritis, when it could signal bone cancer or cancer that has spread to the bones. Frequent urination might be attributed to an aging bladder, when it could be a sign of prostate or bladder cancer. Shortness of breath might be considered a natural consequence of aging, when it could indicate lung cancer. The key is knowing which symptoms warrant medical attention regardless of age. Here are some signals that should never be ignored, even if they seem mild. Unexplained weight loss of 10 pounds or more, persistent fatigue that doesn't improve with rest, changes in bowel or bladder habits that last more than a few weeks, a sore or area of skin that doesn't heal, becomes crusty or bleeds easily, unusual bleeding or discharge from any body part, thickening or lump in any part of the body, including the breast, testicle, lymph nodes, or soft tissues, persistent indigestion or difficulty swallowing, nagging cough or hoarseness that doesn't go away after 3-4 weeks, unexplained pain that persists and disrupts sleep, changes in the appearance of a mole or any new skin growth. In addition to physical symptoms, be attentive to changes in cognitive function. While some memory changes can be part of normal aging, sudden confusion, personality changes, or seizures could indicate a brain tumor and should be evaluated promptly. I encourage my senior patients to keep a symptom journal if they notice anything unusual, recording the nature of the symptom when it occurs, what makes it better or worse, and how long it lasts. This information can be invaluable to healthcare providers in determining whether further investigation is warranted. Have you been dismissing unusual symptoms as just part of getting older, without discussing them with your doctor? This habit of normalizing potential warning signs could be allowing a treatable cancer to progress undetected. Now that we've discussed these 5 dangerous habits that increase cancer risk after 60, let's talk about the practical steps you can take starting today to reduce your risk and protect your health. First and foremost, if you've identified with any of the habits we've discussed, ignoring acid reflux, leading a sedentary lifestyle, choosing sugary drinks over water, avoiding cancer screenings, or dismissing unusual symptoms, know that it's never too late to make positive changes. Even small adjustments to your daily routine can significantly impact your cancer risk. Begin by scheduling any overdue cancer screenings appropriate for your age and risk factors. If you've been putting these off, make the appointment this week. For those experiencing persistent heartburn or reflux, consult with your doctor about proper evaluation rather than just managing symptoms with over-the-counter medications. Incorporate more movement into your day, aiming to break up periods of sitting with short walking breaks or simple stretching exercises. Even modest increases in physical activity can have meaningful benefits for cancer prevention. Make water your primary beverage, gradually replacing sugary or artificially sweetened drinks. A simple approach is to start each day with a glass of water and keep a water bottle visible and accessible throughout the day as a reminder. Most importantly, pay attention to your body's signals. If something feels different or wrong, don't automatically attribute it to aging. Make note of the symptom, how long it persists, and discuss it with your healthcare provider. Beyond addressing these 5 specific habits, there are additional protective steps worth considering. Nutrition plays a crucial role in cancer prevention. Aim for a diet rich in colorful fruits and vegetables, which contain natural compounds that help fight cancer at the cellular level. Limit red and processed meats, which have been linked to increased colorectal cancer risk. Incorporate fiber-rich foods like whole grains and legumes, which support digestive health and may help reduce cancer risk. Social connection is another often overlooked factor in cancer prevention. Research suggests that strong social ties and emotional support may enhance immune function and improve overall health outcomes, including cancer survival rates. Make an effort to maintain meaningful relationships and stay engaged with your community. Sleep quality also deserves attention. Poor sleep has been linked to increased inflammation and compromised immune function, both of which can increase cancer risk. Aim for 7-8 hours of quality sleep each night and discuss persistent sleep problems with your healthcare provider. Remember that cancer prevention isn't about perfection, it's about progress. Each positive change you make reduces your risk, even if you can't eliminate all risk factors. My patients who have the greatest success in reducing their cancer risk are those who make sustainable changes, rather than attempting dramatic overnight transformations. I encourage you to select 1 or 2 habits from those we've discussed today and focus on those first. Once those changes become part of your routine, you can build on that foundation by addressing additional habits. Let me wrap up by summarizing the key points we've covered today. We've explored 5 dangerous habits that significantly increase cancer risk after 60, ignoring persistent acid reflux, maintaining a sedentary lifestyle, choosing sugary or artificially sweetened beverages over water, avoiding routine cancer screenings, and dismissing unusual symptoms as normal aging. Each of these habits can substantially increase your cancer risk, but the good news is that they're all modifiable. You have the power to make changes starting today that could literally save your life. Thank you so much for staying with me through this important information. If you found this video helpful, please hit that like button and share it with someone you care about who might benefit from this knowledge. Remember that knowledge is power, especially when it comes to cancer prevention. By subscribing to this channel and turning on notifications, you'll continue to receive evidence-based information that can help you make informed decisions about your health. Together, we can work toward a future where fewer seniors face advanced cancer diagnoses and more enjoy healthy, active years with their loved ones. Remember, it's never too late to reduce your cancer risk. The choices you make today can shape your health tomorrow. Stay vigilant, stay informed, and most importantly, stay hopeful. Small changes can lead to significant improvements in your health and quality of life.